Good afternoon. I'm Dr. Alfred Abu Hamid, Interim President and Provost of EVMS. Welcome to the EVMS Physician Assistant White Coat Ceremony for the class of 2024. You may be seated. I would like to extend a special welcome to all of our family and friends watching via live stream. I know you must be proud of your students joining the PA program and getting their white coats today. To the class of 2024, today we celebrate your entry into the physician assistant profession, and it's an honor to welcome you into the EVMS family. The past 2 years have presented many challenges to our country, but each member of this new class is a testament to the enduring power of high ideals. You're here today because you want to help others and live a life of service. You are a critical component to the solution to the healthcare workforce shortages. You are the answer to the urgent call for skilled, dedicated healthcare professionals. You are part of an efficient, effective model of healthcare delivery. You chose a school that is rooted in the community and dedicated to the idea that everyone deserves compassionate care from highly skilled providers. It is truly inspiring to look out today and see your faces and to know how much you have sacrificed to get to this point. Congratulations. Your training here at EVMS will lead to more than a great career. As a working professional, you will be part of a movement to expand access to care, improve health in your patients, and change lives to the better. And you will prepare for your career at one of the best PA programs in the country. Our faculty is one of the best in the country, and they are ready and eager to help you on your new path. The faculty you will encounter over the next 28 months are dedicated to your success. Just look at the certification exam scores from previous EVMS PA classes, and you will see a record of educational excellence that rivals any other program in the country. Even beyond your program, EVMS is a special place. Students thrive in our collaborative environment, and I'm sure you will be no different. Congratulations on the accomplishments that have made it possible for you to be here today. You will get the superb training undoubtedly that you deserve. You will succeed in our mission if you become PAs with high ethical and moral values who are leaders in their communities and provide compassionate care to all in need. It is now my distinct pleasure to introduce Dr. Donald Combs, Vice President and Dean of the School of Health Professions. Welcome to EVMS.
Thank you, Dr. Abu Hamid, for the introduction and for your words. You know, there's a saying in politics that often in events like this, everything that needs to be said has been said, but not everyone who needs to say it has said it. And so there are going to be several of us that have some comments. I just want to make a couple of general comments. Number one, we had 1,400 applicants for 80 slots, and we chose you. And we chose you based on your accomplishments so far and the prospect for substantial impacts both in the healthcare delivery system and in the PA profession as you move through your professional career. So I think that it's very important to realize that probably in every single instance you are here because a whole bunch of people helped you get here. They gave you the platform, the support, the love, the kindness, the stick-to-itiveness that is required. And I would ask all of the entering class to stand up and give a standing ovation to everyone, parents, family, friends, mentors who helped you get here. Thank you. It's important to do things like that, to remember when people help you, to express gratitude, because one of the more amazing things in life is if you ask somebody for help, they're highly likely to provide it, and they're highly likely to provide it again if you say thank you the first time. So please, as you go through your profession and as you're helped by your colleagues, your teachers, your patients, don't forget to say thank you. That's very important. Second thing I want to talk just a minute about is COVID. It's been with us 2 years now, and one of the things that has most impressed me, because I simply didn't understand it, and that is this is a novel virus. And we've spent 2 years learning what the virus is. And if you look at guidance, for example, that's come from the CDC or the FDA, sometimes it looks almost random. Well, it's not, but this is something brand new. We've never faced something like this before. And the variant waves that we're seeing are new, and the variants are new, and so we're having to learn over the course of time what it is and what interventions we can make. I think that's a very important lesson for you as you start your learning curve is a lot of things will be new to you, and you need to invest the time and ask the questions if you don't understand it. We're all trying to figure this out, and this is a great time, I think, to enter the PA profession, a great time to enter healthcare generally, because one of the many things that COVID has done is made us aware of the importance of basic practices like sanitation. You know, we grew up not always washing our hands as often as we should. Most of us are pretty rigorous about that now. Most of us are really interested in seeing the progression of the disease, where it is, what interventions are effective. So we're learning to be more data oriented. And that's something that will serve you well as you enter your career is, sure, you're going to develop predispositions and shortcuts and thinking about problems in a truncated way. But when you get feedback from the problem that it's not being solved, that's a great time to ask somebody for help and for you to think about things in a way that's a little different. Because what can happen is we get stuck in a rut, intellectual rut, if you will. We think we've figured it out because whatever we do works most of the time. You need to ask yourself as a professional, though, always, is most of the time good enough, or can we do better? So, takeaways, very short. They even call it in these educational times, lecturette, 2 points. Be generous in your expressions of gratitude, and don't ever stop learning. I'd like to leave it there and introduce the program director, Dr. Kim Dempsey, who will lead you through the rest of the program. Welcome to EVMS. Work hard, succeed. Thank you.
Thank you, Dr. Combs. Welcome to Eastern Virginia Medical School, and welcome to the symbolic beginning of your journey to become a physician assistant. We are very happy to be able to celebrate this special ceremony with our new PA students, and I would also like to acknowledge and thank our friends and families who are watching live. You are now part of an excellent institution. We have great facilities, a supportive and welcoming administration, as you can see, and a very talented faculty with an excellent track record for training very successful new PAs. The PA profession is still very young when you compare it to medicine or nursing. On October 6, 1967, the first 3 PA students completed their training at Duke University. From that initial program and 3 graduates, your new profession has grown to over 280 PA programs with more than 10,000 graduates a year and more than 140,000 PAs that were practicing in the United States in 2020. Last year in the United States, PAs provided care at more than 400 million patient visits in every medical setting and specialty. In spite of that, the United States still needs every PA that we can train. Our profession is forecast to continue to grow much faster than the average for all occupations. Practicing PAs tend to be quite happy with their career choice as well. In surveys conducted by the American Academy of Physician Assistants, nearly 90% of practicing PAs said they would become a PA if they had to make that career selection again today. And 95% said that they would recommend this career to their friends and family. Our own alumni survey mirrors those results, with 95% of respondents saying they were satisfied or very satisfied with their careers as a PA. Over the next 28 months, the program will be a challenge. It may also be a bit of a challenge for your friends and family, as we will be keeping you quite busy. But in May of 2024, you will have earned a rewarding career and a new way of life for yourselves and your family. The ceremony here today celebrates your transition to that new career. It is my pleasure to welcome you all to the PA program and welcome you to this wonderful profession. Now I am happy to introduce Jeffrey Yates, Associate Professor, to tell us about the significance of the white coat in medicine. Professor Yates.
Thank you very much. Congratulations to each of you on accomplishing this exciting milestone in your future careers. This is going to be spectacular. We talked about white coat ceremonies. I can remember mine from over 20 years ago in fairly specific details, and I hope you will be able to also. Those daunting pre-medical and undergraduate years are over. As each of you walk across the stage to receive your short white coat today, your journey as a physician assistant has only begun. The doctor's white coat has become a universal symbol of medicine and signifies a turning point in history and medicine in our country. During the late 1800s and early 20th century, medicine went through a radical and rapid change. As a result of scientific methods and modernization movement, the practice of medicine emerged as a respectful discipline of science and honorable profession. This new identity required a new look, or branding, if you will, and the white coat of the laboratory scientist was adopted to replace the dark, formal black attire of previous centuries. With amazing discoveries that helped prevent, more accurately diagnose, and in some cases definitively cure disease, the doctor became a scientific healer and a well-respected person among all strata of society. The white coat set them apart and symbolized their knowledge, expertise, and even hope of healing. Over the past century, the white coat has remained one of the most recognizable symbols of modern medicine, with many patients considering it a symbol for purity, professionalism, and trust. The adaptation of the white coat symbolizes a change in the trajectory of medicine. This ceremony today and the short white coat you're about to don will symbolize a change in your life and its trajectory in many ways. You are now entering a very honorable scientific profession, or maybe in some cases a calling, in which you will be gifted with the privilege of caring for others. You are now committed to perpetual learning. You are now committed to the lives and health of our patients, our colleagues, and our communities, and most importantly, ourselves. The short white coat is a symbol of future potential. It is shorter than the one you will receive at the end of this program because you are still a young student studying the art of science and medicine. It indicates that you still have much to learn, but in the near future, you will be considered a full-fledged clinician with all the rights and responsibilities. As you embody that potential, use your time wisely, learn how to grow cognitively, physically, emotionally, and spiritually. This white coat ceremony is an important tradition that welcomes loved ones and families, although virtual today. But for you, the student, it is a rite of passage, one that is symbolic of your past success and motivation to become a PA. However, most importantly, in its momentous and exciting occasion, truly a day to remember. As you walk across the stage, please cherish the feeling and importance of humanism as the core of our professional duties to our future patients and our communities. As you receive your short white coat, my hope is that you will feel the weight of this next step and the potential of what you will soon become. An amazing PA, I'm sure. Now I'd like to introduce Professor Angela Cerezo, Assistant Professor for the White Coat Ceremony. Thank you very much.
It is a tradition here at EVMS for our current students, in this case, the class of 2023, to mentor the incoming class. This communication helps ease the transition to the PA program. So it will be several members of the class of 2023 who will be helping our new class as they wear their white coats for the first time. Would the mentors please join us on stage? Ralph Ababio. Rachel Abel. Joanne Aquino. Melissa Armconnect. Antoinette Auger. Jacqueline Barron. And Kristen Barnum. You may now don your white coats. You may now take your seats. Patty Bibizadeh. Shannon Blunt. Christina Briegel. James Britton. Charlotte Burchett. Molly Callens. And Sarah Campbell. You may now don your white coats. You may now take your seats. Nathan Chow. Christina Chung. Derek Cousins. Kaylee Dalton. Emily Dawson. Miranda DeRuz Loudon. And Darren DeMille. You may now don your white coats. You may now take your seats. Kenneth Dixon. Maya Finley. Catherine Gaskin. Sonam Gill. Caitlin Glover. Richard Harris. You may now don your white coats. You may now take your seats. Alexandra Howe. Erica Ianello. Lauren Janicki. Celeste Jolie. Kendall Jordan. Carly Clement. And Lindsay Langlis. You may now don your white coats. You may now take your seats. Emily Latimer. Omar Longoria. Kathy Lee. Cameron Mead. Christine Malash. Lauren Miller. And Alyssa Milvo. You may now don your white coats. You may now take your seats. Nicole Myers. Michaela Nadeau. Laura Nadolski. Udoka Ndugwe. V. Wen. Ellie O. And Rachel Perobi. You may now don your white coats. You may now take your seats. Tyler Perkins. Amanda Perot. Sung Fan. Matthew Pitts. Evan Pugh. Samantha Putnam. And Annabelle Riebel. You may now don your white coats. You may now take your seats. Rebecca Rush. Christina Ryan. Sitare Sefnijad. Katie Sexton. Anna Shiner. Mara Semakaitis. You may now don your white coats. You may now take your seats. Alexis Smith. Emma Smith. Camicia Smith. Catherine Snellings. Tiana Sotepenra. Zeba Syed. And Catrice Sykes. You may now don your white coats. You may now take your seats. Ebony Taylor. Lauren Temple. Jen Tarraco. Claudia Venezuela Carpio. Christina Vickers. Eliza Villena. And Catherine Wall. You may now don your white coats. You may now take your seats. Brianna Ward. Annika White. Madison Weisler. Braxton Wilkinson. Deandra Williams. And Chandler Winnie. You may now don your white coats. You may now take your seats. Mentors, you may now also be dismissed. Roxalana Zukovic. And Nicholas Zobor. You may now don your white coats. You may now take your seats. Mentors, you are also dismissed to return to your seats. I'd now like to introduce Jennifer Wohl, Associate Professor for the PA Professional Oath.
Will the class of 2024 please stand and join me in reciting the Physician Assistant Professional Oath? See page 7 on the printed program. We also invite any practicing PAs on stage or at home to stand and join us in the recitation. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Please be seated. It is my pleasure to introduce Angela Conrad for the closing remarks.
Thank you. Good afternoon. I know everyone is anxious to connect with your family and friends, so I won't keep you much longer. I just have a few thoughts that I would like to leave with our newest students. Remember how you feel right now. By the looks in your eyes, and I'm sure the smiles behind your masks, I would guess that you're happy, proud, and excited. Maybe even a little curious about what lies ahead. I want you to remember this feeling, because you should feel that way every time you put on this white coat. You should be happy that you worked so hard to get to this point in your life. Your path to get here may have been direct or not so direct, but each experience that you had on your way here was important, and it made you who you are today. Remember all those experiences and value them. You should be proud of what you have accomplished and what you will accomplish. This should inspire you to always do your best, whether it's in class, on your clinical rotations in 15 months, or in practice as a PA. Be proud of what you've done, what you are doing, and what you will do. And excited. You should be excited. You're about to embark on a journey that will change your life. Don't let that excitement fade. Things will get stressful over the next 28 months, I guarantee you, and beyond. But remember how excited you are to learn and become a PA. And continue to be excited about learning, because learning never ends. Always be curious. Curiosity is what stimulates learning. Remain curious in your classes. Pursue knowledge to satisfy that curiosity. Remain curious about your patients and their afflictions. It will help you to be a better clinician, and your patients will benefit. Congratulations on being here. We're happy to welcome you to the EVMS family. I'm very proud to present to you online the EVMS program's class of 2024. Welcome to the program and the PA profession. This concludes our ceremony, and in closing, I'd like to thank you all for joining us by live stream and watching today, and have a good evening.